Good morning. I'm actually going to put this here because I like to use my hands when I talk. Okay, I hope that stays. So I'm Lauren Lestage, and I'm currently in my 4th year here at UNT studying music education and vocal performance. When I was asked to speak at this event today, I got a call from Miss Peglar, and she asked me if I'd done much public speaking. I remember thinking to myself, with all the vocal rest I had been on in the past year, I'd barely done any speaking at all, let alone in front of an audience. You see, I had a vocal surgery last November, and with that, I was on vocal rest on and off for about 6 months. Although it's been a pretty difficult journey to get to where I am today, I feel like I have a pretty great story to tell because of it, and I promise I would not be standing here right now if it did not have a happy ending. So, as far back as 7th grade, I knew that I wanted to be a singer when I grew up. My parents, as supportive and loving as they are, immediately put me into voice lessons. This was around the time that I first heard the word raspy associated with my voice. Now, I had no idea what that meant. I didn't know if it was a good thing or a bad thing, but I figured since it wasn't something that we tried to fix, that it must not have been very important. Now, I can't help but wonder, looking back, why my voice teacher never worked with me through that raspiness, whether it was because she believed my vocal folds hadn't fully developed yet, or perhaps just because she didn't really know what it meant or how to help me. Regardless, the issue was never really addressed, so the word raspy continued to be associated with my voice, even into high school. By that point, however, I had started to form my own concerns with my voice, specifically with vocal fatigue. I can remember going to my voice lessons on Thursdays and Fridays throughout high school, and I would have almost no voice. I didn't know why this was, and I would always come up with some kind of excuse and apologize to my teachers for not having my voice. But they would always tell me that it was okay, and we would just sing through my lesson as normal. This was around the time that I started to live by the phrase, sing through the pain. This wasn't necessarily something I'd picked up from my teachers, but it was absolutely something that had been said among my classmates and I, who were constantly competing and pressuring each other to be the best musicians that we could be. Speaking of competitions, my senior year, I made the TMEA All-State Mixed Choir. I remember at the time that was like the pinnacle of my singing career. And I was so excited to go to San Antonio and be a part of this convention and this music making. Unfortunately, however, it was not exactly the experience that I had expected. I remember being so frustrated and disappointed in myself because after the first day of rehearsals, I completely lost my voice. I couldn't understand why this was happening. I was singing just as much and just as little as all of the singers around me, and yet they had their voices and I didn't. What were they doing that I wasn't? What was I doing that they weren't? I definitely left that experience feeling like what happens at TMEA stays at TMEA, because I was so embarrassed and I refused to tell my parents or my teachers what had happened to me. This vocal fatigue was definitely a burden that I carried with myself throughout high school, not really sharing it with anybody. Luckily, when I got to university, I started to learn a little bit more about the voice and my own instrument, and I learned that I wasn't the only person with vocal fatigue. Through presentations given by Dr. Austin and in my occupational health class with Dr. Chesky, I started to become a little bit more curious about my own vocal health. My sophomore year, I got a new voice teacher, one who was not particularly fond of this raspy, aspirate tone of mine. I remember spending weeks working on different techniques to create a nice, clear, and beautiful onset. That was just not going to happen no matter how hard I tried. She ultimately insisted that I go and see a doctor and get scoped just to see if there was something going on there that I had no control over. So I did as she asked. Lo and behold, 2 vocal nodules. Now, I knew what vocal nodules were, but I didn't know what it meant to be a singer with vocal nodules. So my only context for having vocal nodules was actually from a film called Pitch Perfect. I don't know if you've seen this movie, but there is a scene where one of the girls in an a cappella group finds out that she has vocal nodules. And it is as if the world has crumbled beneath her. So naturally, I had a bit of a panic attack. However, my doctors told me that vocal nodules are reversible if you work really hard and you go into vocal therapy. So I did, and I started my vocal therapy and went on for about 6 months, really trying to find the root of my trauma, as well as working through any bad habits that I had formed in compensation for that trauma. During this 6 months, I started to feel so much better about my voice, my speaking voice, my singing. I felt amazing that I had all this knowledge about my own voice. Unfortunately, about 3 months after I stopped going to therapy, I started to feel really sick. So I went in and saw a doctor who told me that I showed signs of acid reflux, symptoms that I'd probably been having for years. So there I was, 3 months with no vocal therapy, untreated acid reflux, and I had still been singing almost every single day. So as you can imagine, my vocal fatigue came back, and it was much, much worse than before. I could barely talk, and my singing was so inconsistent. Excuse me. But I knew at that point that I needed to go back to the doctor and get scoped again. So I did, and we found out that not only had the nodules not reversed, but they'd gotten worse, and one of the nodules had developed into a vocal polyp. So I spent 3 weeks on complete vocal rest, no talking, no coughing, no yawning. Okay, that's being a little bit dramatic, but we were doing that in hopes that the polyp would show some sign of reversibility. Of course, with my luck, it did not. So at that point, I felt like I was being told if I wanted to continue on in school as a music major, that I would have to have a surgery to remove the polyp. So I had the surgery, and it was successful. Of course, I didn't know at the time how difficult it would be post-op at Christmas at home with my family, not being able to talk to any of them, let alone sing in church like I had for the past 10 years. All of these, excuse me. Although I'm standing here today, and I'm a year after my surgery, and I am fully recovered, I still make active decisions every single day to make sure that my nodules and my polyp don't come back. Things such as sleeping at a slant at night to treat my acid reflux, things like attempting to get 8 hours of sleep every single night, and things like giving up caffeine. I feel so proud to say that I know all of these new ways to take care of my voice, and to me, that knowledge is completely priceless. Although I knew it was going to be hard to stand up here and tell you my story, I'm actually very grateful for this opportunity because I know that this event is just an incredible step towards me and my journey towards knowing and loving this voice that I was given a second chance with. So thank you so much for listening to my story.
I want to thank Lauren for stepping out on the end of the gangplank and sharing, what is obviously a very sensitive and emotional issue. In my role as chair of the division that Lauren studies in. I was a part of the team that helped her manage her continuing studies as a music major, right? And there were some tricky moments there where we had to make some decisions about juries and about vocal study and about how we manage just the day in and day out of participating in an ensemble, when she's having vocal difficulties. So it was a challenging time for all of us. And I get emotional over it too, because I was there with Lauren to see her work through this. And I have heard Lauren's now clear and ringing voice in the halls as she uses her voice in a normal, healthy fashion now. And it's just an amazing thing to see. Our voices are our primary means of letting the world know who we are. We communicate with each other, with our fellow human beings, with the use of our voice. It allows us to participate in humanity, much like we heard earlier that being deprived of the ability to hear tends to isolate people. Not being able to speak or to sing, if you're a musician, certainly contributes to a sense of isolation and of separation and of loss, certainly as we heard Lauren talk about, the loss of not being able to participate. In our modern world of electronic communication, sometimes we may lose sight of how important being able to speak to one another is. I know I'm like you. When I walk into my office and I sit down to my laptop, there are about 80 emails there every day that have to be responded to. And I've also noticed in the last few years that in my mailbox in the music office, I very rarely have a written memo there anymore, right? They might as well do away with those things. Everything is communicated electronically. But to be deprived of the ability to communicate with your voices is a traumatic event. A great example of this. Do you know when the first organ transplant happened? Some of the doctors will know this. A human organ transplant back in the 1950s. It was a kidney from one twin to another. And there have been several landmarks of human transplantation. I remember in 1967, the first heart transplant. I remember that because my father was on a list for a heart transplant back in those early years. Human organ transplant is now a very common thing. They happen every day all over the United States and all over the world. The human larynx, however, is a very complicated structure that serves multiple purposes, not just for communication, but also for swallowing and other very important things. And in the history of organ transplantation, there have only been two. The first one was in 1998. At that time, a young man by the name of Tim Heidler, who as a younger man, 20 years before, was a motorcycle enthusiast. And Tim was out riding on the property of a disgruntled landowner who had strung a cable between two trees. And Tim hit the wire with his neck. It fractured his larynx and it had to be ultimately removed. And so he spent 20 years as a 20 to a 40-year-old man without the ability to communicate. This is what he said. I'm going to have to step over here so I can read it to you. Communication is the main goal in everything. Without communication, nothing works. That's why a lot of people who have had laryngectomies stay at home. They just sit at home and ferment to nothing. So Tim was the first. He volunteered. He heard that a group of doctors were looking for a volunteer for a laryngeal transplant, and he volunteered. He put his life at risk. But it did restore his voice. I remember being at the first professional meeting where this case was talked about, and we heard him and saw him in the recovery, and after a few years, his voice was restored to at least a satisfactory level. The next one didn't happen until 2010. A 54-year-old grandmother in California put her life at risk to have her voice restored so that her granddaughter could hear her say, "I love you," in her normal voice, and not the robotic voice from using an electrolarynx on the side of her neck. Amazing stories, they're the extreme cases, but it just to inform us of how important voice is to who we are and to what lengths some people will go to restore it. So I'm the chair of Division of Vocal Studies. I'm professor of voice, and I teach our vocal pedagogy classes. I started off as a performing major, a couple of degrees in voice and operatic performance. But after 2 degrees and the Metropolitan Opera hadn't called me for a job, I thought I was looking around trying to figure out what I was going to do the rest of my life. After a couple of turns here and there, I ended up studying speech pathology, where ultimately I earned my PhD at the University of Iowa in that field, studying voice science. And that combination of my vocal training and my voice science training has really opened up some unique opportunities for me in the way that I am able to help folks like Lauren in my own exposure to them as students, in sort of triaging what goes on in the College of Music, or a College of Music. Able to point them in the right direction to Dr. Ling Lu, who helps us out tremendously every year in seeing our students. Voice problems are very common in student singers, student musicians. We have around 180 voice majors in our division. Every year, 10 to 15 of them experience a significant enough vocal problem that it interferes with their normal course of study. So they have to sit out of the choir, they have to postpone their juries, these sorts of things. So it's a very common thing for us to experience because the load is so high. Do you know in the population of the United States, the workforce, public school teachers represent about 4% of our workforce. When we look at the people who end up in a clinical environment for their voices, that number goes to 20%. So, I'm way ahead of myself here, sorry. So excessive vocal dose is related to these voice complaints. Public school teachers are the ones who really get it in the teeth. We spend millions of dollars every year paying substitute teachers to come in to take the place of teachers who are not able to conduct a classroom. Similar things happen in our music school. Our music students are under such high demand, high stress, a lot of vocal use, and it can lead to a problem. The good news is that staying vocally healthy is primarily behavioral. There are some very simple things that we can learn to do, and more importantly, learn to teach our teachers to teach, so that when they're out there conducting the choirs and the musicals and the things that they do in middle schools and high schools, that they will be able to recognize a student like Lauren who's having vocal trouble and be able to, number one, recognize it as a problem, and number two, be able to help them through this problem. This is something that isn't a part of our standard course of education, and it should be. I looked at some students in our College of Music a few years ago using some very sophisticated measurement equipment, and we were able to measure the number of vibrations that the vocal folds experience in the course of a normal work week for them in school. We were able to compute how far the vocal folds traveled in that amount of time. This overachiever right here, vocal folds traveled a total of 23 miles, and that's at about half a millimeter per oscillation. That's a lot of oscillations. That's a lot of collisions. Human tissue under collisions like that don't do very well. It's the same reason why we experience hearing loss. Tissue and vibration is a problem. Lauren mentioned her Allstate experience. I think it's a great system that we have in the state of Texas. It develops a lot of great musicians, but sometimes it can be a bit problematic. I went and pulled the rehearsal schedule off of a recent year. I don't think it was the same year that Lauren participated, but I think it's pretty common. So these high school kids arrive in San Antonio, and they go right into rehearsals, and they're there all day. And then at night, of course, they go into their rooms at 7 p.m. and get 8 hours of sleep, right? No, they don't. They're in San Antonio, they're alone, they're having a great time. There's a lot of rehearsals involved with this. 19, almost 20 hours of rehearsals in 2 days. That's an excessive vocal load, especially for young kids who don't have a solid technique yet. That would be a stretch for a highly trained adult professional. So there are things we can learn to teach and to know. Don't sing when you're sick. That's primary. Don't sing when you're sick. I never teach a sick student a voice lesson. If I hear raspiness or roughness, I know the voice, and if I hear that it is uncommon in my experience with that voice, we reschedule. I don't teach them until they're well. I also ask them to sit out of choir. Their ensembles, our directors are very understanding about that. And we try to make sure that people don't abuse that privilege. And then other things like elevating the bed, drinking a lot of water, they're very simple things to teach. But we need to know what it is that will help our students stay healthy. We need to be able to teach that to our student teachers so that they can go out and make the world a better place. Thank you very much for your attention. I want to introduce Lisa Rich and Travis Harris as our next presenters.